Hello friends, let us now learn some important points about the school health. In the school health, most commonly detected morbidity in school children includes the dental defects. These include dental defects more than goiter, more than malnutrition. So dental defects are more common in school children. So for school children, we have put forward the school health examination. School health examination is put forward in 1961 by Renuka Roy School Health Committee. Renuka Roy School Health Committee laid foundation for comprehensive school health program in India. In Renuka Roy School Health Committee, medical examination of children is done at the time of entry into the school, and then thereafter every 4 years we do comprehensive medical examination for the children. Then after that, new guidelines have been put forward by National Rural Health Mission, who recommended that the children medical examination should be done once in 6 months. They also put forward school eye screening program. The school eye screening program, here we mainly focus on middle school children, that is between 5th to 8th class, between 10 to 14 years of age, and all the teachers do screening for students. That means one teacher will screen almost 150 students, and if they find that the visual acuity of the student is less than 6/9, then they are referred to the nearest primary health care center. Then we have healthful school environment. When do we call it as healthful school environment? The school should always be located away from the noisy surroundings and always kept fenced so that no unknown person enters the school. The school should be at least 5 acres for primary school and 10 acres for higher elementary school. The school should have external walls which are 10-inch thick and they are heat resistant. 10-inch thick walls should be there, and in the classroom, one classroom should be present for 40 students. Only 40 students should be kept in a classroom. Per capita space for the school should be more than 10 square feet per student. Furniture should be single desk of mainly minus type. Doors and windows area should be more than 25% of floor area should be there for doors and windows. The color of the walls should be white. The inside color of the walls should always be white. Lighting should be normal from the left side. From left side there should be normal lighting. Water supply should be safe, portal, continuous through the taps. Lavatory, if you see, there should be one urinal for 60 students and one latrine for 100 students. So these are the different recommendations for school health. Thank you guys for watching my lecture. Thank you.